Hello and welcome. I'm Christina Maguire, President and CEO of MDI Hospital. Before we begin, I want to thank you for the vital role that all of you have played to fight against COVID-19. Your continued vigilance has kept us remarkably safe, and we are so grateful for all the efforts as this great community and also within our individual workforces. We are here today to answer your questions and provide information about our vaccine process for COVID, the testing updates, and to share information about lessons that we've learned over the past year. Yes, it's almost been a year. It's hard to believe. But across the globe, the biggest vaccination campaign in history is underway. Worldwide, there's 205 million doses being distributed and 111 million cases have been recorded. More Americans now have received at least one dose than have tested positive for all of the virus since the pandemic began. In Maine, nearly 300,000 doses have been administered, which includes 10,000 doses in Hancock County and more than 2,000 doses to from MDI Hospital. Statewide, we just want to share with you some of the statistics statewide, and we have 296,000 doses for 43,000 cases. And in Hancock County, we have 10,795 doses given, and we have 879 positive cases. Sadly, the one national statistic that we have to share with you is that the United States is approaching 500,000 deaths. And we are hoping with the vaccination process and programs that we are undertaking, as well as what we are doing in the nation, will start to have a greater impact on those numbers. As we continue to work together to combat the global pandemic, MDI Hospital and our community are very fortunate to have a team of highly skilled health professionals dedicated to our regional response. Today, you'll hear from 3 of our colleagues who are in the forefront of the coronavirus prevention and preparedness efforts at MDI Hospital. Dr. J.R. Krevans Jr., Trevor Casey, PharmD, and Kate Worcester, physician assistant, certified physician assistant. Dr. Krevans is the chair of our infection control committee at Mount Desert Island Hospital and has been a guiding force in all of our COVID-19 preparedness and planning responses. He has an extensive background in public health, emergency preparedness, and the management of infectious disease. Trevor Casey is the director of pharmacy and emergency preparedness, infection control, et al. There's quite a few other things that Trevor oversees, and we're very appreciative of everything he's been doing to help us with managing the COVID response. Trevor has taken the lead role in our vaccine administration efforts in coordination with an interdisciplinary team of physicians, pharmacists, nurses, geriatric practitioners, and infection control specialists. Kate Worcester is a certified physician assistant who has been our primary COVID-19 testing practitioner and has taken the lead role in providing COVID-19 education, counseling, and contact tracing assistance to residents, visitors, as well as our school district. During today's town hall, we will discuss COVID-19 updates, answer your questions, some of which were submitted in advance, and we'll start with those today. If you would like to ask a question during the discussion, please use the Q&A feature, which is located at the bottom of your Zoom screen, and enter your question. We will answer as many questions as possible, time permitting. We have an hour today from 4 to 5, and those that we do not have time for, we will try to address via email after the event. And now please join me in welcoming our moderator today, Molly Moon, who will facilitate today's discussion and begin our questions. Molly?
Thank you, Chrissy. Our first question is for Trevor. Trevor, can you elaborate on who has been vaccinated so far? How many are in the 1B demographic? How you are prioritizing people who have pre-registered in the 1B group? And how many people age 70 and above are currently pre-registered?
So as of today, we have vaccinated 1,562 individuals. And we've given 716 of those individuals have completed their regimen. So that's a total of 2,278 total doses that we've given out since December 23rd is when we first gave out our first vaccines. Just to break that down a little bit further, over the age of 70, we've given out 206 doses to those over the age of 90. We've given out 440 doses to those between age 80 and 89, and 307 doses to those 70 to 79. Left registered as of this morning, it does change continually, but as of this morning, we had 13 people registered that were over the age of 90. Those people have been called multiple times, and we haven't been able to get a hold of them yet. And we'll continue to call them until either they've told us they've got a vaccine somewhere else, or they don't want it, or we get them in for a vaccination clinic. We have 597 people that are between the ages of 80 and 89, and we have 2,890 people between the ages of 70 to 79. Our priority has really been we started with our priority of those in healthcare workers. We're all vaccinated. And then long-term care, we focused on those in long-term care and congregate housing on the island. And then we're focusing on those super seniors in our group. So those above the age of 90 is where we started, and 100 plus. And then we worked down to those in the 80s. We really hope to get through a large majority of those in the 80s this week, and then really try to get down and focus on those in that lower age group of 70, where we can get those vaccines as soon as possible. If we have been trying to vaccinate households as well, so if there was a 90-year-old husband and a 75-year-old wife, we are trying to do that vaccination at the same time for ease. That did change a little bit from the beginning. We have made some changes along that process, but that is our current process. We are trying to get as many people vaccinated as quickly as possible, but it is taking us some time to get through everybody. But we're not wasting a single dose, and we're moving forward as quickly as we possibly can to get everybody vaccinated.
Thank you, Trevor. Our next question is for Chrissy. Chrissy, are you able to anticipate the number of vaccines arriving next week? And how many arrived last week? And how will these doses be allotted?
So the one thing that we don't have is a stable and reliable allocation process. It is the main CDC determines the allocations. We feel that we're starting to see a more stable allocation, and it's based on a three-pronged approach that the CDC applies for allocations. One, do you have the resources to provide vaccines to the community and further the priorities such as Tier 1A and the identified Tier 1B? Two, have you used all the doses that you have in the past? And if you're not holding doses, then you will be able to do that. And three, what is your willingness to continue to do vaccine clinics? So as long as we demonstrate that we have at least a pipeline for vaccines, we received, or unfortunately, the weather has had a supply chain impact on our allocation for this week. The locations where the vaccine comes from, unfortunately, we're in the middle of that winter snow conundrum in Kentucky and in Tennessee, which impacted both the Pfizer and the Moderna distributions. Pfizer is not as impacted as the Moderna, which is what we receive. And so we are scheduled to receive 500 doses. 400 of those will be, or about 350 of those doses will be used for our greater community. But what we are so pleased is that we partnered with the state to develop a plan for our outer islands. And 150 of those doses will go to our outer islands as well. Last week, we received approximately 200, plus we received concurrently the second dose allocations for those individuals who have received their first doses and that they're receiving their second doses. So it all depends on those criteria and the allocation process from the state. But we are starting to see that it's upticking, and that's what we want. We want to be able to see a standard anywhere from 500 to 1,000 doses a week so we can get all of our community members, patients, residents, and beyond taken care of.
Thank you, Chrissy. And Kate, how many positive cases of COVID-19 has the hospital tested to date, as well as how many total tests?
As of date today, we have done approximately 5,900 tests total. 200 of these have been multiplex tests, which means emergent or urgent tests where we get results back in less than an hour. We've had a total of 5,812 negative tests, and we've had 78 positive tests. These are on testing individuals who are symptomatic, close contacts, preoperative patients, and some asymptomatics that have had close contact as well. All of that's done initially through our tent system we had in the summer, which is now transitioned over to a winter testing facility for the winter months here on the campus.
Thank you. JR, can you explain the phases and how they may differ on the state level in comparison to the country? And what if I'm in a different group and have a higher risk?
So the way Maine has done their phases is fairly close to the original CDC guidelines, which other states have changed it quite a bit. So basically with the state of Maine, their initial, what gets confusing is that they talk about 1A and then 1B and then 1C, but each of those has multiple subgroups within it. And I think that's one of the things that's caused confusion. So 1A, which we mostly completed in the state of Maine, was healthcare workers, initially for critical health services, and then later other patient-facing healthcare workers, residents and staff of long-term care facilities, and those were the two first groups that were done. But then within 1A, also included public safety personnel, fire and rescue, police, and COVID-19 response personnel, people involved in testing and certain of the public health responsibilities for response to public health. And 1A is not completely done in the state. There were some of the healthcare institutions that did not get vaccinated and did not get supplies for their workers in the initial round. And so those people are being sent elsewhere as a priority. So for example, our vaccine clinics are getting people who are driving from more than an hour away who are assigned to us by the state to receive their vaccine here, healthcare workers from elsewhere. We're glad to do that. As 1A is finishing up, we have started 1B, and 1B is a very large group, and not all of 1B is the same priority. The group of 1B that the state has currently instructed us to start is Maine residents over the age of 70. And the state of Maine has given instructions that over the age of 70, the state is not separating those people by medical risk. They've said basically because they want to not make it too complicated and they want to allow different institutions to prioritize different groups within that they are saying everybody over the age 70 is now priority, we'll call that priority 1B, first group in 1B, and that's what we're doing. Our institution is, by taking names and then calling, is trying to do the older first, and some of the people who are part of, for example, family groups, as Trevor mentioned. Other places in the state are prioritizing on the basis of ability to get to clinics. There's the big mega clinics where people drive from hours around to get to, and that's great if you have transportation and can spend the day doing that. The Walmart clinics have the same prioritization. They're also for age 70 plus, and they have their own sign-up system. So basically, anyone over age 70 is priority 1B, and that's where the state is allowing us to vaccinate so far. There's another group of 1B, which is the next portion of 1B that we'll get to once the most of the people over age 70 who wish vaccination have been vaccinated. And the way the state defines that is eligibility pending due to insufficient supply. So in other words, they're 1B, but they're not eligible yet until we have more supplies. And one group of that is persons who are under the age of 70, people who are 60 to 69, and then adults, any other adult with certain high-risk medical conditions, and certain critical frontline workers. And that's literally the way it's worded in the state, certain critical frontline workers. If you go to their more detailed thing. They say this, the federal CDC has listed what they think are the most critical workers, and the state lists the CDC and says, but we have not decided yet if we are going to use the federal CDC priorities. It says the state of Maine will review the list and make determinations as this phase approaches. And they have not told us yet which of those groups they are going to want us to do in what order. I think it's real important for everyone to remember that we administer the vaccine, but the vaccine belongs to the state, and we administer it absolutely under the state's rules. But right now, if the state chooses to follow federal CDC, it'll be food and agricultural workers, postal service, but not other transportation services, some manufacturing, grocery store workers, public transit workers, the education sector, which is defined broadly, including teachers and teachers' aides, and it also includes daycare. And so that would be the next group of workers if the state chooses to follow federal CDC, which we don't know if they will. Some other states have prioritized some workers ahead of seniors. Some other states have started out at a younger age range. And sometimes that has actually resulted in mostly younger seniors getting vaccinated. There's a lot of states where there's more people between 60 and 70 getting vaccinated than between 80 and 90, which medically is not what you would want to go for, because someone 80 years old is probably about a factor of 5 more likely to suffer harm. So that's where we are, and the state of Maine looks at the data on a regular basis and tells us where to go next.
Thank you, JR, for clarifying that information. And Kate, back to you. Variants have been a point of concern as of late. What can you tell us about the potential coverage the vaccine offers for variants?
What we can say in general is this is an evolving process, and we have a vaccination that is being rolled out as quickly as possible. At the same time, as we have a virus that feels the pressure and the stress of those getting vaccinated. And so what happens to the virus over time is it starts to mutate and change because it wants to keep living. So we've seen mostly in the public eye right now is the UK, the Brazilian, and the South African. Those are the three that we hear the most about. And what pretty much what data has shown thus far is that the current COVID vaccination we have gives us good coverage against the UK variant. It also looks like it makes it so that we're not able to transmit the UK variant if you are vaccinated. And I'll pull in an answer to one of the questions I saw in the Q&A with both of your doses, and you've had 14 days, so you're fully vaccinated. It is felt that you're less likely or unlikely at this point to transmit the UK variant. The Brazilian and the South African variant, they're seeing fewer cases. So, and certainly fewer cases where it's actually faced a person who's vaccinated and fully completed. So again, it's a process of really, it's an epidemiological study as to see how this vaccination will cover us. But what we believe is that it covers us to a level where if we were to get illness from a variant, it would be mild. It would be a mild illness, not the life-threatening illness of coronavirus that has caused this pandemic. So the most important piece is getting everyone vaccinated, getting accessibility to vaccination. And then those of us who do excessive reading and trying to follow how this virus is mutating and changing, we'll be trying to look at where we go from here. Most likely, we will be looking at a booster at some point, which would include coverage on those spike proteins that have actually changed or mutated in those variant types of the SARS-CoV. But that's not something we need to worry about yet. It's more important to get the vaccination out, but that would be how that process would look in the future.
Thanks, Kate. Mm-hmm. Trevor, can you address if someone is contacted for an appointment, who would the email, the phone call, or the text appear from, and where do they go to get their shot? And then what happens if they miss that contact?
So currently what we're doing is we are actually calling everybody to schedule, and that may come from a hospital line. Most of those calls are being made from the hospital phone, so it would show up MDI hospital. There are some people using cell phones to help out with that calling and doing some of that from home. So it may be a personal cell phone or a work cell phone, which should show up. It may be me, maybe show up as Trevor Casey is giving you a call to schedule an appointment. And so right now we're doing our vaccination clinics at the Bar Harbor Regency. They've been so kind to offer that space to us, which has been fantastic because it has an awning where people can pull up underneath it and they can get out. It helps avoid the weather and allow them to get directly inside the door. And it's a flat surface with limited ice and limited capability for it to have to deal with the weather as they're coming in. So we really appreciate their willingness to help us out with that. Our health centers have also started vaccinating, and they're reaching out to schedule those patients and working with, and they're working through that. We are asking people not to call the health centers to try to schedule an appointment. We're reaching out to those people through the registration list. If you haven't registered on our website to get the vaccine, please do so. We can continue to hear about people who haven't registered. If they need help registering, they can call our COVID hotline, they're more than willing to help people register for the vaccine if they don't have access to the internet. And so when they get a call, we usually know on Monday we start scheduling for Thursday and Friday vaccine clinics based on when we receive the vaccine. It's all done in a quick time frame based on when we receive the information from the state. And so it may seem like it's a very short turnaround because it is a very short turnaround, not only for you, but for us as well. And so we have a very short time to get everybody registered and get those vaccine clinics put together.
Thanks, Trevor. Now, Chrissy, a lot of people want to know, what if someone is from out of area? Will you still vaccinate them?
So that's an excellent question. And out of area has been defined for Maine state residents. And we have some more prescriptive language that the state was crafted and provided to us last week. And it really states that you have to have an address here in the state of Maine. But we also were told from the DHHS and Dr. Shaw, who oversees the Maine CDC, is that everyone in the priority that we are in, whatever tier we are in, should receive a shot. We should not turn them away. We obviously want to make sure our community gets a vaccination. That is always our number one priority. But the overall public health initiative is to get shots in arms, if you will. And so if you're out of the area, out of our service area, and you register, we are going to be fairly blind to that, except if you're out of state. We are not allowed to give a dose from individuals who do not reside or have an address here that they can produce two forms of bills, utility bills, etc., showing that they have a local address. Other than that, we would certainly, as long as you're within the tiering priority that we are currently addressing, we would put you in line for a vaccination.
Thank you, Chrissy, for explaining what Maine state residency qualifies as in terms of receiving the COVID-19 vaccine. And JR, where does school staff in Maine, so teachers, ed techs, and admin, fall in terms of priority?
So we think that they're going to be in the first occupational group of 1B, which is, right now we're in the first medical group of 1B. So like I said earlier, not all 1Bs are the same. If the state decides to use the federal guidance, and we listened attentively, and I know Chrissy was actually on with them either this morning or yesterday, and they did not change anything as of then. The other thing I should mention is if you work in a school and you qualify as another priority, we go by the first priority. So if you're 72 years old, you're eligible right now as someone over 70, and a teacher with medical issues, say high blood pressure and kidney disease and diabetes, which might be a lot of people in the school system, a lot of conditions like that. They might end up being vaccinated under their medical priority first, but we're going to have to wait for state guidance on that. something that Chrissy sort of mentioned earlier, but I think we need to be really clear about is if we go outside the state guidance in our use of the vaccine, we will no longer get vaccine. And so it's not like, this is a decision that we can make, that we think that teachers should go next. And there have been some recent things, which if you looked in the paper, there was a area in Maine that thought they should do their teachers and very urgently had to ship the doses back down to the nearest hospital when they were told, nope, those vials you opened cannot be used for that. It's very, very straightforward.
Thank you, JR. Trevor, our next question is for you. Many people seem to have better luck with larger healthcare systems throughout the state and now Walmart. Why is this? Are individuals canceling their registration with MDI Hospital if they have received their vaccine elsewhere?
So the main reason that they're having better time is because they're getting, Northern Lights is getting on average around 5,000 doses a week, and we're getting between 2 and 500 doses a week for our community. And so we have a very limited amount of doses to give out to our community. Walmart is getting 200 doses a week. And so that's really our limitation, is the amount of doses per week that we get. That's why there's more opportunity, more doses in Bangor and in other areas than what we are being given by the state. We do have capacity to do more, and we're constantly working with the state to get more vaccines. And let me just. And then the other part of that question is, are they canceling? And yes, people are canceling, and they're doing a great job of that. And we really appreciate those cancelings if they're getting those appointments other places. The best way to do that is actually to email the COVID vaccine at mdihospital.org, and it's listed on our website as well, and send that email, and then we can take their name off that list, and we'll get their name removed. And we really appreciate those that are doing that.
Trevor, maybe we can qualify also. When we began the registration process, we were not, we are encouraging everyone to register, correct? So
yes.
Maybe you can elaborate on that.
Yeah, so our registration program does divide people up by age groups and tier groups. And so we do highly encourage everybody to register if they're interested in getting the vaccine. It doesn't go anywhere. We can't do a lot with that information right now, except for we do give that information to the state on how many people we do have that have registered and are ready to get a dose. So far, we have over 9,400 people that have filled out our survey and our registration. And we're welcome anybody who would like to get a vaccine to fill it out and pre-register with us. And we'll get to you as soon as we're able to through the guidelines, and we have the doses available.
Thanks, Trevor. Kate and JR, community members would like to know, does quarantine procedure change in Maine if I've been vaccinated?
I think JR and I are going to tag team this one. We talk about it all the time. As of right now, it is not different. If you are vaccinated, you still, I think JR is already going to intercede here, but you still have to follow the same guidelines, even if you are vaccinated, with the test within 72 hours before or after you get here or there, and if not, the 10-day quarantine.
So
I anticipate that to change soon as we get more people vaccinated and we have some more time with individuals out there, and the state has some time to loosen those measures.
Right. Now, Kate just answered that same question. Actually, you'd word it the same way for 3 different circumstances. So Kate just answered the question, do you have to quarantine if you've been vaccinated when you return from outside the state of Maine traveling to a higher risk area? And the answer is yes.
Yes.
That hasn't changed. That same question can be asked of the circumstance. Do you have to quarantine if you are exposed as a contact?
Mm-hmm.
And the answer to that is now no. If you are fully vaccinated, and fully vaccinated is defined as and right now, until we get another vaccine out there, but for Moderna and Pfizer, is 2 weeks after your second dose of Moderna or Pfizer, you are defined as fully vaccinated. And for the purposes of general quarantine? Can you go to the grocery store? Can you attend school if you're a child? Though children were not vaccinating yet. Do you have to quarantine if you are exposed? The state of Maine says no. And that's partly because right now we have a few UK variants in the state, but as far as we know so far, none of the Southern variants. There's a third place that question could also be asked. And in fact, this has come up also that Kate and I have had to answer, which is if you're fully vaccinated and you work somewhere and you're exposed, can you go to work? And the answer to that is it depends on your workplace. So right now, even if you're fully vaccinated, if you work in healthcare and long-term care, you can't go to work if you're exposed.
The other piece is if you're vaccinated, fully vaccinated, and you become ill with symptoms that could be suggested of COVID, you do need to be tested again. And that's something that was new to me. It's just starting. This is something every day where I call JR and say, okay, I have a fully vaccinated individual here with, cough and cold. Do we test them again? Now, again, though, we're looking at where do they work? What do they do? But we should test because we need to gather that information to learn more about this virus. So.
Yeah. And one other little piece of that wasn't quite in that question, but links along with it. If someone has had a documented positive case for 90 days thereafter, except under extraordinarily rare circumstances, they don't need to quarantine if they're exposed, and they don't need to be retested. Basically, only if they're highly immunosuppressed. So these get into sort of some subtle questions, but they're going to become really common questions in a few months when we have lots more vaccinated people.
Thank you, guys. Do either of you have anything else to add to that question?
No, we could go on and on forever about it, but we can leave it there.
Great, we'll scoot on. So Chrissy, most people will be feeling cabin fever soon, if not already. Can you explain why, even if I have been vaccinated, why I can't travel without having quarantine?
So both Kate and JR really alluded to this, but I will tell you that operationally, it depends on certainly a business. A business may choose to be more cautious, but for the state of Maine has what's known as executive orders during a public health emergency. This is what we are under. And the governor has issued a executive order that does not allow individuals who have traveled beyond the exempted states. And as of this weekend, that was still New Hampshire and Vermont. I don't believe that's changed. They have to either receive a test 72 hours upon arriving in Maine, and that is a negative PCR test, or they have to remain in quarantine. So it's actually the law. That is what we uphold, is you can't travel without avoiding a quarantine. But if you do, you have to be tested upon arrival. And again, different organizations are handling this differently. They have different operational policies and procedures. In healthcare, we are extremely conservative because we want to protect the health and vibrancy of our community, our patients, and our residents. So we actually adhere to the state law and require either quarantine or testing. But we also, with regard to whether or not you've been exposed, to JR's point, and you're fully vaccinated, which is after receiving 2 weeks after your second dose, that you may come in contact with a positive person, that you still need to adhere to our quarantine policies. So there is some, it could be specific by business as well.
Thanks, Chrissy. Possibly one of the most popular questions that I'm seeing here. JR, can you address why, if I have been vaccinated, why do I still have to wear a mask?
Okay, so that really is the same question yet again in a slightly different form. And it's sort of, so here's where it is. This is something that I think about a lot. And understand that I'm part of the group that's tried to work out how we can maintain our business community open, how we can keep our schools open. and how we can make rules that work. And this is where the data is changing very fast, and we have to be honest that we're looking at data that has just changed in the last 3 or 4 days. And we will get more data over the next few weeks. And then I know the state is worried that we might get some changes beyond that as the virus evolves. But there was no proof in the original studies. So the vaccines were tested extraordinarily carefully in terms of safety and extraordinarily carefully in terms of how well does my vaccine keep me from getting sick. And the answer is it's really, really, really safe. And it's really, really good at keeping me from getting sick. And there's almost no contraindications to either of the first 2 vaccines. So that's great. What the big concern has been, if I'm not going to get sick, if I'm infected, I won't know if I'm sick. So could I be infectious and spread it? And in the last, I think on Friday or Saturday, we got word out of Alaska, and that's through connections I have directly with there, where I used to work in the public health service, that in some of the isolated villages that were having some very bad outbreaks, bad enough that they were given enough vaccine to vaccinate all adults. Within a week of people getting their second dose, spread stopped. And now there is data as of Sunday, I believe it was not published, but released. It's not formally published yet, out of Israel, where they have given about 40% of their population has had 2 doses of Pfizer. And they are seeing the same thing, that transmission is starting to rapidly decline. So we now have some fairly good data in the past week in humans. We had data until a couple of weeks ago just in monkeys, that the messenger RNA vaccines will prevent transmission of the original virus, the Italian variant, which is what most people in this country have, is the Italian. What we call the original virus here was actually the Italian variant. It came here from Italy, not from China, but that's another interesting story. And the UK variant are all probably well covered, we think. At some point in the near future, once that data has been reanalyzed and officially published, there may be some changes in recommendations or law about masking. The difficult problem is, there's 2 difficult problems, one of which is how you can't know who's vaccinated and who's not in a public square. How do we deal with that as a society? And the answer probably is, for right now, everybody wears masks in certain public squares. Once those studies are confirmed, if you know you're vaccinated, or you know that your parents are vaccinated, does that mean you can visit them without a mask and not worry? Probably, once we have that data confirmed. Does that mean that we should not have masking in our public stores? I don't think so. I don't think that works. The next bigger question that we're going to need to face as a society, not as individuals, these are societal questions, is what about once everyone who's at high risk of bad disease, everybody over the age of 60 and anybody younger than that who has a medical condition, which is about 20 or 30% of the population. Once all those people have been offered a vaccine, and the chances are if it does spread, it's not going to kill anybody. You know, it's a bad disease, but it's not, if you vaccinate all the highest risk people, it's less problematic than, say, flu, once everybody's vaccinated. Let's be very clear. You know, we don't shut down society for every disease. That's the time when we need to really look at what the rules are going to be in public, and that's going to be a very difficult question. So a lot of tough science followed by some difficult politics that is very reasonable. But I think I wouldn't be surprised if we see some changing personal recommendations over the next couple of weeks based on the data from the last 4 or 5 days.
Thanks, JR. Kate, I have an interesting question for you to weigh in on. Is it possible to test positive months after a COVID-19 infection?
Yes. What we've learned is one of the reasons why the CDC does not recommend testing again at the end of your quarantine is because an individual can test positive for months. So far, I would say the longest one I've seen anecdotally is over 2 months of being positive. But despite the fact that the individual tests positive, they aren't able to transmit the illness. And that's where it's really important. Pretty much mild to moderate illness, the quarantine is 14 days. Severe illness in hospitalized patients, they are still recommending that 21-day quarantine just because your viral load is so much higher. But when we look at how long will these individuals actually test positive for the COVID antibody and for the COVID test, we're finding you can be positive for a very long period of time. Therefore, the concept of being testing negative before you can go back to your job or your workplace or your life, or it's not medically doesn't follow truly what the medicine says. It's that's not, you got to follow when can you actually transmit this virus, and what does this test mean? It means that you did have COVID and that you did develop the antibody and that the test was accurate. And when we keep retesting, unfortunately, these people are staying positive for longer than we thought. But that doesn't mean that they're out there transmitting COVID to our community. The other thing I wanted to add here, I think Jared was going to say something too, but one of the important things is that we have accessibility now to more emergent or urgent testing. And I use it a lot more than I did initially because we weren't sure how many tests we were going to get. And we're now allocated a pretty strict amount that's consistent each week. And we're not running through those so quickly that I can't utilize them to quickly shift and change gears according to what patients I'm seeing. And getting back those quick results is really important because it reduces risks of any transmission. And it also, something we're going to talk about a little later in this, starts to qualify individuals for receiving early interventional therapy that really reduces their potential for developing a more advanced or complicated form of coronavirus. And that the fact that we do have that ability here at MDI Hospital, we have 2 machines that do that, is just fantastic. One of the other anecdotal things I've seen is one of the rapid tests we do tests for flu, A and B, and I have not had a case of flu this winter come through. Every single patient I've seen with cough and congestion and fever and all the symptoms of coronavirus, which also could be influenza, I have not seen a case of influenza due to the hygiene, social distancing, mask wearing, and guidelines we're all following. I think Jared wanted to add something there. So.
Yeah, I mean, people worry a lot about this concept that people could test positive later. And I want to reassure people there's some really great studies out of Korea where they followed people who went back to live with their families or live in worker dorms and places like that, and then recurrently tested positive. And what they found is that once people were 10 days out, they basically didn't transmit, even if they had measurable, because understand, it's not like the test that Kate does is an extraordinarily sensitive test for genetic material. It doesn't necessarily test for live virus. And there's often, you're going to have small amounts of genetic material from the virus present in your, well, basically, let's be honest, in your snot. There's a lot of little crevices up there, and the genetic material can sit up there for a long time, and it doesn't mean there's live virus that can transmit. This has been very well studied. And I want to reiterate what Kate said. We have the ability to rapidly test within an hour. for people who are at very high risk of bad outcomes. And we also have availability of the antibody cocktails, monoclonal antibodies. Well,
I'm not saying it.
you want me to say it? Bamlanivimab.
Yeah.
We make Chrissy say it. It's much more fun.
I'll go after you with the monoclonal antibody because I think everyone needs to know about that.
Right. And so if people, especially people who are at high risk, if you're 75 years old, if you have kidney disease, lung disease, heart disease, and you have symptoms consistent with COVID, it's worth getting tested early because we can make a difference in outcome. Why don't you, Kate, could talk about that?
Yeah, so we now have the availability of monoclonal antibody, which is a therapy. Our specific monoclonal antibody we have here, I've cut short and I call it BAMLAM because I think it's Bamlanivimab, I think, but there's a great skit out there that Chrissy told me
Let's
about.
just go with BAMLAM. I can handle that one.
I call it BAMLAM, and these are for individuals who would be at high risk of developing more severe disease. To be an inclusion patient to receive this therapy, they need to have had less than 5 days of illness. So that means coming in early with your symptoms. It also means that we need to be using our rapid testing or emergent testing more readily to get those results back so that these individuals can get the therapy started immediately. It is something called with the monoclonal antibody therapy, it's called an emergency use authorization. So it's a non-FDA approved therapy because it hasn't had enough time to go through testing, but has been shown to be efficacious in reducing the severity of illness and the critical nature that some individuals develop in those more complicated cases with COVID. These individuals are individuals who are not hospitalized. They are typically, hopefully most of them are not on oxygen. If you're on oxygen, you need to be at your baseline and not with increasing oxygen demands if you're a person who's on chronic oxygen. And the other comorbid conditions that JR talked about, but when I look through these and as a community member, you think about if you fall into this group, of course, diabetes and chronic kidney disease, immunosuppressive therapy all falls into that. But also, if you're greater than 65 years of age, period, you could be included into this. You just have to make sure you would come in the first 5 days of your illness. If you're greater than 55 years of age and you have cardiovascular disease, or you have high blood pressure, or you have COPD, I will tell you that's the majority of the patients I take care of. And then also the subset of kids 12 to 17 years of age. And I'm not going to say all the different little pieces because we don't see a lot of these, but who have pretty severe asthma, who require daily inhalers and have nebulizers at home, they fall into that group as well. And I just find, I see all of the questions in the queue there are all about the vaccination, but I like to sometimes step back and say, okay, but my job is to take care of people who have, who have COVID. And what can I do? And I feel like we've been given this ability now to have an intervention, as well as we've received so much education on when to treat, how the timeline looks. I've taken care of many, many COVID positive patients now to see what it looks like, what it acts like, what a recovered patient looks like, what a long hauler looks like. And I think the ability that we have the availability of this particular therapy is outstanding. And we've already developed a process as to how we early identify these individuals. Like the second you pick up the phone and you say, hi, I'm so-and-so, and we take down your date of birth and we realize you're over 65 years of age, we're already considering you a BAMLAM patient. We call it a BAMLAM PUI. So we've made it into its own telephone system so that we can identify these individuals early so that if the individual wants to receive the therapy, they can receive the therapy. And I could go on and on about it because it's really quite fascinating, but certainly it's an antibody therapy that's been found to reduce that progression towards ARDS, towards the multi-inflammatory, multi-organ injuries that we see with the more advanced cases of COVID.
Thanks, JR and Kate, for sharing some enlightening information on BAM-LAM therapy. I do have another question for you, this one coming from our live chat. If two people are living apart and are fully vaccinated and subsequently test negative, can they safely spend time together?
So, want me to answer that?
Sure, go ahead.
Yes. I mean, yes, I would still, certainly, again, that we fall back on when they're spending time together. Certainly, if they develop any cold-like symptoms, we would test them because we're still testing the vaccine. But the vaccine, thus far has been shown to give very good coverage. And the reason we do get vaccinated is so we can spend time with our loved ones. JR was going to probably add something more to that. So
I was going to just say yes.
Okay. We agreed.
Thank you both. Chrissy, how are we preparing for this coming summer? Will asymptomatic testing and masking programs be available again?
So we are planning to do planning for the same type of summer that we had last summer, and we are working with our partners in this community, part of the Down East COVID task force, including municipalities, the school district, the Chamber of Commerce, are so many partners throughout Mount Desert Island. And we will be doing the masking initiative again. We will be providing to our businesses those masks and the prevention measures and the PSAs around masking, distancing, and hand hygiene. We feel that we have been incredibly vigilant in this community, and that is why we have had some of the lowest positivity rates in the entire state of Maine. It's because our community has been very vigilant and compliant with those prevention measures. The asymptomatic testing that we were able to partner with the state of Maine, I'm working with the state right now to see if they're going to continue the swab and send site. We had a pilot site that was part of what we were doing to test front-facing workers. As you know, we are a tourist community in the summer, and we have quite a bit of transient nature of visitors. So we wanted to be able to have front-facing workers have an opportunity for surveillance and asymptomatic testing. That was a public and private partnership. So it was the state and then community members such as MDI Hospital helped fund that project. It goes until March 31st. So I'm working with the state to see if they will extend that or have intentions to extend all of the swab and send sites. What I do know is they have repurposed quite a bit of their resources that have been handling the swab and sends and the asymptomatic testing to a different initiative, and that's a vaccine initiative. So we are not sure of their intention to continue that. That said, we are still working on making sure that we have some availability for testing, because we do believe that we will not hit herd immunity with the level of vaccines that we're receiving in allocation, and that we should have some platform to perform testing, PCR testing. So we'll continue to do that work.
Thank you, Chrissy. Trevor, I've received this question a number of times. How can I confirm that my registration is still active with MDI Hospital after receiving the initial confirmation?
It's active. We have it there. We haven't lost any. And the system we use has a backup. And so we check it regularly to make sure that it's up and running. And we know that you're not hearing anything from us if you're down further on the list, and we apologize for that. But we will get to you as soon as we possibly can. And we will be calling. That will be our goal, is to get to you as quickly as we have the vaccines available to get to you.
Thanks, Trevor. And it looks like we have time for one more question. Maybe we can do a roundtable here for each of you. Can each of you tell us what lessons you've learned and how you would apply that to the community? Christina,
Kate, you want to start? I'll start. Actually, the lessons that we learned would all be around planning, really around how to plan effectively, work with our partners, engage our community in what we're doing, and really work to identify those the barriers, but also where we can put resources for success. It was a tumultuous year. March 13th was the very first test MDI hospital did, which is only a couple weeks away from our 1-year anniversary. And so we understand how difficult this has been on the community, but planning and being prepared has been by far the flagship of what have made us successful. And again, to the vaccine program that we've been able to do. We were ready to launch the vaccine clinics before we had allocations of Pfizer or Moderna in this state. We started planning for that in September. So I think our lesson is ongoing planning and preparedness. Kate?
The thing I said right from the beginning when this virus, the pandemic began was, I need time. We all need time right now and not have this explode so we can learn about it. And I think with what we did in our community here, we just did an outstanding job throughout our entire summer with having so few positives. It gave scientists and physicians and any medical practitioner and researcher time to figure out, okay, how do we actually treat this? Because I focus so much of my day on how do I actually treat people? And with time now, we actually have interventions we can do to improve your outcome. We learned that what we did initially out of the gate didn't help improve your outcome. We've learned that certain medications work really well at certain times in the illness and don't work well at other times in the illness. But by giving us that amount of time where we had that very low positivity rate, we as providers now here have the ability that if you do become positive, we can help you. And we can really reduce the likelihood of you developing severe disease. And as much as we all want to run and get our vaccination right now, if you certainly get ill, I feel we're so much more well equipped and capable to take care of you and treat you and offer you some interventions that will really improve your prognosis. That's what I've learned. JR, you're next.
JR, could you go next?
Go, JR.
Okay, I guess what I've learned the most is the importance of accepting risk and understanding risk. And when I say accept risk, there's two different ways that you do that. One is you accept risk, meaning that there is a risk. Some of the worst problems we've had with this virus, both in this country and elsewhere, have been when people have refused to accept that there is a risk. Denial of reality does not help us here. So you have to accept that this is real. You have to accept that there's a risk, and you have to accept your responsibility to prevent risk. You know, if you're a 32-year-old marathon runner with normal kidneys who looked at a cigarette once and decided you weren't interested in them, you're at pretty low risk of getting severely ill yourself. You're not at low risk of transmitting it to everybody else. And so we have to accept that risk, and we have to accept our responsibility for whatever we can do in our work and in our daily lives to mitigate that risk. But the other thing, and this is coming now to get some out of this and to move forward, is we have to accept some risk. We have to accept that, you know, this was a disease that was so awful and so pervasive that we had to change our way of life. And that last happened for most people in this country in 1919. For some communities, including communities I've lived as part of, that happened in the 1980s, and it happened in the 1990s. But for most people, that's new. But now we have to say, okay, we did some very tremendous upheavals to protect ourselves. And in Maine, it worked really, really well. But now we have to accept some risk to transition back into ordinary life, and making decisions around that and accepting that as a community is going to be real important.
Okay. Trevor.
Trevor, you're up.
The biggest thing I think I've learned, and my lessons learned, is is empathy, patience, and teamwork. As we've been giving these vaccines out, we know how important this is to you and your family members. We know the difference that this vaccine makes. And every day I come to work and I go home, you can ask my wife, it's on my shoulders to try to figure out how to get this vaccine out to as many people as possible. And we don't waste a single dose. Though many people have asked how to get on the call list, we continue on our same call list that we work through with those that are above the age of 70 to bring them in. We give, if there's an extra dose in a vial, we give that dose as well. We're doing everything we can, and we understand that it's very serious, and we take this serious, and we look at this as a very serious opportunity to get people vaccinated as quickly as possible. And this comes with patience as well. I sit down in many meetings with these people that are here, and we're all just like you, wanting more doses, and we're planning to try to get up to where we can do a throughput of 1,000 doses a week for our small institution, which is a large number. But we'd love to be able to have the vaccines to be able to do that. And that's our goal. And that's what we want to work with the state on and get to for our community. And last thing is teamwork. Teamwork for the community members, the hospital staff, and everybody who's stepped up and taken a role in helping us be successful in getting these vaccines that we have out. It's been impressive, and we continue to change and try to make our processes more efficient. And we just thank everybody for all their assistance and everything that's gone on.
Well, thank you, panelists and Chrissy, for taking the time to address these questions that are on the minds of so many of our community members. I'm going to now hand it back over to Chrissy to close.
Thank you, Molly. But thank you all for your thoughtful questions and joining us this afternoon. I know there are several questions in the Q&A that we were not able to get to, but we will be addressing all of those either in an FAQ or directly out to the individual who asked those. I'd also like to thank these subject matter experts, our panelists, for taking the time to share their insight, expertise, and I think you can see their passion and dedication to taking care of our community. I am honored and always humbled to be and work with them. As we look forward to a time when we can gradually reverse these precautions that you all have been so diligent brought about by this pandemic, we want you to know how grateful we are that what you're doing and making a difference to keep your community safe, to keep everyone in and who you are around safe from the spread of COVID-19. We have to say it, masking, distancing, avoiding crowds, and washing your hands is the best way to prevent the spread of COVID. And it is our public health mantra. So please, as you continue to mask, you continue to do distance, and we know it's hard on everyone, please just continue that vigilance while we work through vaccinating our community. And as we work to get through this together, because we are a community, a vibrant, healthy community, MDI Hospital is committed to providing you with the evidence-based care and as much information, education, and support as possible. So again, thank you all for your commitment to our health of our community. Thank you, panelists, and our moderator, Molly, and our public affairs team for the work that we are able to put this forum out to our public. So have a great evening, and we wish you health and happiness.